I remember telling my mom when I had the opportunity to first start to open the unit, she was like, but you're never going to be in there taking care of those patients, are you? And I said, Mom, of all the places in the entire world to work, safety
Yeah.
is the very
Very.
first concern. And we will, even if something says you only have to wear a mask, most of the time we'll do a mask and booties and goggles and all those other things for anything, which we ended up completely doing for the Ebola virus disease. We wanted
Yeah.
to make sure that because there was so much unknown, we couldn't just pull out a policy or procedure from down the street and modify it and just put NIH Clinical Center. We really had to make sure that we were providing safe patient care, not just to the patients, but for
Yep.
the staff.
And I just remember from July through August into September, we just kept looking at all of our policies and procedures, all the stuff that you put into place. And then all of a sudden they're saying, well, with this specific disease, for example, with the GI symptomology, we're going to have so much trash. Can our existing autoclave keep up with it? And then how do we get it down there? Well, this cart is kind of hard to push. Maybe we need a new one. And everything just kept being revised. And I'm like, okay, can we just stop at some point? Because I got to start training people.
The joke we always have in nursing about things always happen at Friday at 4 p.m. And the very first phone call we get that a patient in West Africa is going to be transported here happened when?
Friday, 4 o'clock in the afternoon.
Yep.
I was actually shaking when I was dialing your number to tell you,
Yep.
we're getting a patient.
The amount of staffing in order to make sure that the patients were well taken care of and the staff was well taken care of was huge. I mean, a completely different impact than we had for any other patient population. And for Ebola virus disease, nobody really knew anything about it because everything had been done in West Africa. So nobody really knew what worked or what didn't work.
These were all healthcare providers who had cared for patients with Ebola in Africa.
Right.
And so they were in our shoes 10 days ago.
Right.
They would tell us, don't touch us because it's spread through contact. It's a whole different level of care. And it takes a certain kind of character to stop a physician or anybody else and say, stop, you need to listen to me.
Right.
You're not following the steps.
When we got the very first patient, we had several of the staff, your one nurse, the daycare provider, said, thank you very much, but we're no longer going to provide care for your child.
Yep.
And then wasn't the husband who their basic employer said, thank you very much, you don't need to come back. Yeah, don't come back to work.
Yep. There were bumps in the road, shall we call them?
Yep.
But it's amazing, the whole community, the whole group, we just did it.
All of our patients went home.
And walked out of here on their own power.
Yeah. That's what people come here to work and do. It's a public health hospital, and this was a public health emergency. Granted, it was a global health emergency because it affected the entire world. But, what a really awesome way to be able to show the world that we are such a really wonderful resource.
It is.
And can help patients survive something that pretty much is deadly in any other country but here.
It's been a very interesting history-making journey.